Mr. Little?
Yes, ma'am.
Hi, come on back. I'm Mary Lee Hanneman. I'm the nurse here in the thoracic surgery department.
Nice to meet you.
Come on back.
Okay.
How are you, Miss Little? Nice to meet you.
Nice to meet you.
We're going to go right back here to room 4. Just follow me. So you're coming in from Alabama?
Yes, ma'am. I live close to Muscle Shoals, Alabama.
I see. I see you have you on your Roll Tide hat. I hate to tell you, I'm an LSU fan.
Okay, thank you.
Have a seat in the first chair right next to the desk for me.
Okay.
And Miss Little right next to him. So let me tell you a little bit about what we're going to be doing today. Since you're, is this your first time at Vanderbilt?
Yes, ma'am.
Well, welcome to Vanderbilt.
Thank you.
How we kind of run our clinic is I'll be doing your vital signs, and then I'll have you filled out some new patient information. I'm going to enter everything in the computer. So we're going to be talking, and I'm going to be typing a lot as well. We don't do too much writing anymore in our charts. So don't think that I'm not listening.
Okay.
I am. I'm just typing and talking at the same time, okay?
Mary Lee does a nice job in terms of going to the reception area and calling for Mr. Little. Does a nice job escorting him down the hallway. The other thing I really like here is a little expression that there's life outside of medicine. I'm sorry that she's an LSU fan, but the nice thing about it is that here's an opportunity to link to another individual about something where there is an experience, again, outside of the healthcare setting. That's important. Families often tell us that they never get a sense that we see them as human beings with lives outside of those moments that we spend with them in the exam room. And this was a really nice example of expressing interest in something else that this individual clearly is interested in, that is Roll Tide. Now, the other things that I observed is that it's important to provide an explanation that we listen. And one of the challenges that we have in this computer age is, in fact, how we make visual contact, that we send the clear message that, patient, we do hear you, we are responding. I think a very nice technique is to affirm to the patient that we've heard them, and in fact what we're doing is recording their observations, because that's an incredibly important part of the medical process. This is the first time that Mr. Little looks anxious. So if you look at him throughout this point, we're now back in the exam room. We're getting closer to the point where we're going to have to deal with the challenge that brought us here. And some acknowledgement of fear and concern can often be very important.
Dr. Putnam has a partner, Dr. Eric Lambright. So there's 2 surgeons here in the department. Both are very excellent. Dr. Putnam sees patients on Tuesdays, and Dr. Lambright sees patients on Wednesdays. So just to let you know, he does have another partner here, and occasionally, they'll see each other's patients if it is needed.
It is important to introduce all the potential members of the team. Again, a part of this process of keeping people aware, if they're partners that may be engaged in care, may have to cover when someone's out, it's important to tell individuals in advance that they may see someone else. One of the other things, though, that might be provided as a reassurance is that there's the mention of 2 days a week in which physicians are there to see one. What about the other days of the week? Will there be someone? So sometimes the issue of providing explanations may, in fact, create additional questions that need to be addressed. And one question in this circumstance is, gosh, if I have need of a physician on Monday, will there be someone here to see me?
Vanderbilt's an awesome place. It's an awesome place, and you'll be treated like you've never been treated before. This department works really hard in taking good care of our patients. From nursing through the medicine part, through the scheduling part, we have a great department. So I'm happy that you're here. Okay, Mr. Little, this is actually concludes our history and physical. So let me just tell you a little bit about what's going to happen the rest of the day for you. You've met with me, and I've done your history and physical and your vitals. Then Dr. Putnam will come in, and he will see you and do his history and physical and his consult. He'll give you his recommendations, and then you'll meet with Allison, who's Allison Duncan. She's our surgery scheduler. She's been doing surgery scheduling now for our department for about 2 years, and helps with coordinating the cases and setting up for your appointments. And then after that, you'll be finished for the rest of the day. Now, I don't know if you're aware, but Dr. Putnam is the chairman for this department. He's involved in a lot of research and works with many of the other departments, such as oncology and pulmonary. So you'll have access to all those wonderful physicians and nurses and teams. Our department is actually getting ready to merge with the oncology department, so we'll be housed all together. So it makes it more convenient for you as a patient to be able to come in and get all of the services that you need under one particular clinic. Okay. Do you have any questions for me?
No, you pretty well covered it good.
Excellent, excellent.
Okay.
If there's anything else I can do for you, please let me know.
Okay.
All right. Very nice to meet you.
Nice to meet you too.
It's really important to orient people to the healthcare system that they're a part of. And sometimes changes occur in those healthcare settings. And yet I think that orienting someone also has to be balanced, though, considering where they are in their own illness at that particular moment. And so it is important at some point to let Mr. Little know that there may be changes, but at the same time, I would suspect that at this particular moment, Mr. Little is most concerned about what kind of surgery he may need, what the prognosis may mean, what is this going to mean for his life. And so I think it is not unreasonable that in a circumstance like this that he may not well remember the messages that are transmitted, which means that sometimes we just have to follow up and do it again for a host of very valid reasons. Another concern that I would just express is that it is very important that we in fact manage up. It is important to send the clear message that our determination is to deliver the best care that we can deliver. It's important to recognize, however, that we don't always achieve our intended goal, and when we don't, we have to have equal amounts of humility to acknowledge our failures in the same way that we are attempting to manage up our entire health system. One of the other things that's incredibly important is to always give people an opportunity to ask questions. One of the things that was modeled in this segment was to see whether or not Mr. Little had any questions. One of the techniques, though, that I think is incredibly important to go along with this question, again, is to take a significant pause after asking an individual, do they have a question, to be sure that, in fact, they've had adequate opportunity to voice that question, because sometimes it takes people a while to, in fact, formulate that question. I think it's incredibly important for all of us who are engaged in healthcare delivery to pause periodically, to reflect about how we have interacted with our patients, how we, what things we've done well, what things we could do better. Pausing and reviewing a video like this is incredibly helpful, because when I do that, I see things that are modeled that are incredibly good, and I need to emulate those things. But you know, the other thing I see is that I see some things that I might have personally done different, in the same way that people who would watch me in the practice of medicine would say, gosh, I like this, I don't like that. That's okay. That's a part of the learning process as we attempt to learn from each other, to encourage each other. It's also important, and it's seen throughout this video, how individuals have used their own personal skills to link with patients, to send the message that they are individuals, that they have lives outside of medicine itself. We know from lots and lots of research studies that families just want a sense that we respect them as human beings. And if we ask somebody if they're an Alabama fan, that in itself sends a very clear message. I think it's also important that we develop tools, or we have tools to help remind us of principles that are very important in engagement. the issues of being sure that we have identified who we are, what people are to expect, to give them a sense of how they should be oriented to the process. Those tools help us to become the professionals that we can be.